Inside the front lines of the pandemic, overwhelmed by the unending number of the sickest and at times the angriest of patients, the world's nurses find themselves running out of patients.
If a nurse had to choose between, keeping a job and coming home, with a broken jaw or coming home traumatized every day.
With infections spiking and concerns about the Omicron variant, why are nurses burning out and checking out in record numbers? We explore on The Inside Story, pandemic nursing fatigue. Hi, I'm Carolyn Pursuti, reporting from Washington. I'm standing in the center of the newsroom here at Voice of America. For nearly 2 years, our office space has been mainly dark as employees continue to work through a global pandemic, mainly from home. In a few moments, we'll go inside a different group of workers, the nurses who had to report to work on the pandemic's front lines. But first, a new coronavirus variant. It was initially identified in South Africa. The World Health Organization identifies it as a variant of concern and has named it Omicron, the 15th letter of the Greek alphabet. President Joe Biden has issued a travel ban for 8 African nations. His top doctor, Anthony Fauci, says it will be 2 weeks before the U.S. can measure Omicron's effect. VOA's Arash Arabasadi reports on efforts to contain this new variant.
Days after South African health officials announced the discovery of the latest coronavirus mutation, now known as Omicron, travelers in Johannesburg say this feels like deja vu.
After being stranded for 2 years because of COVID, not seeing your family, my parents were deathly ill, so I had to come back when the borders were open to come and see them. And now, only to realize, well, it's happening all over again.
Many countries have already started barring or restricting travel from southern African nations.
The reaction of some of countries in terms of imposing travel bans and such measures are completely against the norms and standards as guided by the World Health Organization.
Dr. Pata called the travel restrictions draconian. U.S. President Joe Biden's chief medical advisor, Dr. Anthony Fauci, said travel restrictions won't stop the virus's spread as much as they will buy time to act.
Utilize the time that you're buying to fill in the gaps. And by time biding, you learn more about the virus. You learn what its relationship is to the antibodies induced by vaccines. And above all, you use this time to really, really put your pedal to the floor and get people vaccinated and get people boosted. It's going to give us a period of time to enhance our preparedness.
Fauci went on to praise South African officials for their quick transparency in identifying and sharing details of the Omicron variant. Fauci says it's too soon to talk of lockdowns, but urged booster shots and wearing masks. Meanwhile, South African health officials continue studying the mutations against the efficacy of current vaccines. More than a dozen countries report at least one case of the Omicron variant. Arash Arabasadi, VOA News.
Overwhelmed with patients, limited staff, and exhaustion, the toll of the pandemic is hitting registered nurses the hardest, especially here in the United States. As some are learning to cope with ongoing grief and mental health issues, others are leaving hospital bedsides, which is creating a work shortage. I spoke with a few nurses about this crisis and their strategy to manage this problem.
When U.S. President Joe Biden stepped onto the tarmac in Scranton, Pennsylvania, he met Jen Partika. See the white note in her hand? She handed that to the president.
I did feel like it was important that he understand that the nurses are not okay.
Partika has been a nurse for 30 years. During the pandemic, nurses have worked nonstop and are still stretched thin. Partika lost a colleague to suicide and has seen extreme exhaustion.
We have been absolutely tapped. We have been, fighting this fight. We did not expect it to go on so long.
That has led to a nursing shortage.
I've had a 50% turnover in the past year.
The official recommendation is a 1-to-2 ratio of nurse to patient in the intensive care unit. Partika says a nursing shortage is making it 1-to-3.
That's the only way you get to go to ICU now, is if you're really, really like the sickest of the sick, because there's no bed for you. So tripling those patients is incredibly, dangerous.
And that has led to burnout in the hospital emergency room.
I was just crying so inconsolably, and I couldn't stop. It was a full body cry.
G, who asks that we only use her first name, had a panic attack while on the job. It temporarily paralyzed her ability to speak and function.
All of a sudden, I couldn't fill out a simple form. My brain was not making connections in the same way.
The nurse became the patient. She now sews scrub caps for healthcare workers as part of her recovery after spending a week at a psychiatric hospital for PTSD. G says she wasn't the only nurse being treated there. As if COVID isn't enough, nurses here in Philadelphia and in several other U.S. cities face an onslaught of patients from another menace. The homicide rate is skyrocketing. VOA spent several hours on the streets with Philadelphia police. This is a double shooting.
I got another one up here, Sean. I got another one up here.
Police regularly load victims into their cruisers instead of waiting for ambulances. Some weeks, the slayings equal the number of COVID-19 deaths.
Every single day is like combat levels of casualties coming through our doors.
Alex Caspin works as a nurse at a Philadelphia hospital. After she developed a panic disorder, she was moved from the ER to a pediatric floor, which she says saved her life.
There was a point in time where I felt like I was not present for my family. I was giving my all to my patients, but I don't think that there was much left over for me.
When medical work affects a nurse's well-being, experts call it compassion fatigue. The U.S. healthcare system is fighting a nearly 2-year battle with no ending in sight, as nurses leave hospital bedsides and emergency rooms for less stressful work, many carrying their guilt with them.
One way or another, I would not be able to continue with this job. And I loved being an emergency room nurse. I really loved being an emergency room nurse. I think it was my true calling.
The American Nurses Foundation surveyed nearly 10,000 nurses in August. 34% said they were not emotionally healthy. 42% said they experienced some sort of trauma as a result of COVID-19. And those numbers are significantly higher for nurses who work in the emergency room or in intensive care units. Among the many reasons, an increase in attacks against healthcare workers. VOA's Veronica Balderas Iglesias has an inside look.
Clipped to his ID badge, Nurse Benjamin Coe has something extra, a panic button.
I've only been physically assaulted by a patient twice, but every single shift that I've ever worked as a nurse, at least one patient is going to use curse words at me, is going to make violent statements towards me.
Coe says the COVID-19 safety protocols aren't always welcome.
They're taking their frustration out on visitor policies and the vaccines, and the treatments have just been so over-politicized that it's politics at this point that's driving the problems.
A September survey from National Nurses United shows that 31% of hospital nurses experienced workplace violence, up more than a third since March. ICU nurse Mawata Kamara says a national nursing shortage is partly to blame.
We have more people getting agitated for things such like waiting too long in the emergency room. Unfortunately, the reality is I have other patients that are also equally sick, and I can only delegate a certain amount of time to this patient.
After being assaulted, nurses can report what happened to supervisors or the police, but they don't always do so. On social media, however, they are not so shy.
Nurses are afraid to report anything because of retaliation, because of feeling that like they're going to be blacklisted, or they're told by the facility not to make a report because of patient satisfaction scores.
That's where accountability breaks down. No reporting means attackers can get off scot-free, explains Richard Moreau of the Emergency Nurses Association.
We're up to approximately 31 states that have felony laws. So if you violently assault an emergency nurse, if you are convicted and it's a felony, it's generally a year of jail time or even more.
A proposed law in the U.S. Senate would require employers to protect nurses and others from reprisal for reporting abuse. It also mandates tailored prevention plans. The Maryland Hospital Association represents 53 hospitals and 7 health systems. In the last 5 years, its members have taken multiple steps to prevent workplace violence.
More cameras, more actual security guards, sometimes with canine.
But with all the politics in this pandemic, security only goes so far.
The nature of healthcare in a hospital is such that you can't eliminate the opportunity for harm. I mean, you've got to have caregivers and patients face to face.
Nurses like Kamara want a seat at the table when hospitals plan for safety.
Nurses don't want to quit, but if a nurse had to choose between, keeping a job and coming home, with a broken jaw or coming home traumatized every day, I think a lot of people would choose their peace of mind.
The more than 4 million registered nurses in the United States have shouldered a huge burden in the pandemic. A little help from their patients, they say, shouldn't be too much to ask. Veronica Valderas Iglesias for VOA News, Washington.
In the U.S., the vitriol and violent rhetoric is typically about wearing masks and getting vaccinated. Debbie Moore Black has worked as a registered nurse on the front lines for 3 decades. She says COVID-19 has been unlike any other health crisis in history, and not just for the sheer number of sick people. Let Debbie tell you what she told us in her own words.
You stupid, you don't know what you're talking about. You're nothing but a liberal. You're the one giving the misinformation, not me. It's like, please, I can't even deal with you. Hi, my name is Debbie Moore Black, and I'm a registered nurse. And I've been an ICU nurse for 33 years and recently a behavioral health nurse at a local hospital in Charlotte, North Carolina. When I graduated from high school in 1974, my mother pushed me out of the house and said I had to be a nurse. And eventually I was pulled to the ICU one day, and then I became dazzled by all of the mechanisms involved in ICU, and I was hooked. In ICU, every day is totally different, and it's nonstop, and there is no 15 or 30-minute break. It's 12 hours grueling. When HIV came out, we were scared to death. And in fact, our ER usually admitted most HIV patients to the intensive care unit. And we did gown and glove. And if you even got urine on your forearm, you needed to be tested. We were that scared. But, it took time, it took education, that, practice your washing your hands and things like that. But it certainly wasn't nearly as devastating or scary as COVID has been. When COVID came, the hospital was flooded with just COVID. And then your same-day surgeries were kicked to the curb. Planned surgeries, even emergent surgeries. If Charlotte wasn't open to those patients, then they had to go to another city. And some patients, if it were an emergent surgery needed, did not make it to that next city. And we were flooded in every unit, whether it's intensive care unit or coronary care unit. It was COVID, 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 wherever you went. I also helped out at the front entrance of the hospital. And of course, they could not go any further past our desk without masks on. And we fortunately had public safety there to really protect us, because we had many family members who were very belligerent, and they were saying, I'm not going to wear this, and we had a lot of profanities coming our way, total disrespect to us, and they were refusing. But there was this incredible amount of ignorance. This is my rights. You are infringing on my rights. I'm not going to wear a mask. You're not going to force me to get the vaccine, even though these are the same people who have had smallpox vaccine and polio and all of those other vaccines that their mama made sure they got as a youngster. You should trust in God. He's going to protect you. And they go on and on and on. And I just stare at them, look toward the public safety. They stand up and escort them out. I'm 66 years old, and I say my prayers too, that I don't get COVID, because I could be a target. I wish people would respect science more than they respect social media, more than respect their spiritual feeling that it's never going to happen to me. Virus does not discriminate. It doesn't care if you're a Republican or a Democrat. It cares if you don't get a vaccination. It cares if you don't wear a mask.
In that August survey by the American Nurses Foundation that we mentioned a bit earlier in the show, 50% said they're considering leaving the profession. Now that's half the nearly 10,000 nurses that were surveyed. And it is putting patients at risk. I spoke with several nurses who opened up about their difficult decisions to leave their hospital jobs that they love and where they think America's healthcare industry is headed.
A veteran emergency room nurse we will call Clara is so worried about her profession that what she's about to say could get her fired. Many months into the COVID-19 pandemic, Clara says hospitals are so short-staffed that patients are dying in the emergency room who might otherwise be saved, including one of her female patients.
Ultimately, by the time someone was able to get to her, she was at a point of disrepair. That's the best way I can describe that. We weren't able to fix her, and ultimately she died. That's hard to carry.
Family members are sent to hospital parking lots for lack of space as the sick wait most of the day to be seen.
People are literally shoulder to shoulder. You could be sitting next to someone that is COVID positive and you're not. It could be 6, 8, 10, 12, 16 hours before you get that care that you need to get better.
You heard right. She said up to 16 hours before any treatment.
It definitely is a crisis.
Abigail Donnelly left the hospital ICU earlier this year to create the advocacy group Impact in Healthcare to fight for policy change. She spoke on Skype.
Nursing ratios are terrible. The workload has become unbearable. Nurses are getting hit. They're being verbally abused.
The American Nurses Foundation says the pandemic is causing 9 out of 10 nurses to think about leaving their hospital jobs. Half say inadequate staffing is the main reason. So where are they going?
Travel nurse.
Travel nursing.
Travel nurses.
Travel nursing.
Michelle doesn't want us to give her real name because she's in the minority of nurses who are unvaccinated. She left her hospital when a COVID vaccine mandate was introduced. An agency hired her as a travel nurse to fly wherever she is needed for short contracts.
I'll literally be making in 1 week what it takes me a month to earn.
Nurse Johnny Sorber loves his New Jersey job and his colleagues. The nurse in the middle left for a travel nurse job in Alaska that pays $10,000 a week.
It's just absurd.
Yet tempting for Sorber and his young family. Sorber says hospitals need to find a way to retain and lessen the stress on veteran nurses.
I think just higher pay. At least something. Like higher pay, and there's always a shortage of nurses. If you could get the right amount of nurses so you don't actually have to work harder.
We asked the American Hospital Association about that idea, higher pay and more nurses. They had no official comment, but sent VOA a document asking Congress and the Biden administration to intervene, to, quote, use its authority to investigate anti-competitive pricing, unquote, from agencies hiring travel nurses. But for now, some hospital nurses are at the point of complete exhaustion, with compassion fatigue, a lowered ability to empathize. They were thrown into a pandemic war beyond their control and are still fighting, with ever fewer staff.
So just try to be kind. We want to do what's best for you, and where we're at right now in healthcare is really scary.
In our weekly Press Freedom Spotlight, we are concentrating on Mexico, where covering crime is dangerous for reporters. 8 journalists have been killed in Mexico since March of 2020, according to the Committee to Protect Journalists. Even with state protections available, many Mexican reporters say they do not feel safe doing their jobs. Reporting from Mexico from the U.S. southern border, Victor Castillo brings us one local journalist's harrowing story of survival.
It was the day that crime reporter Jesus Humberto Gonzalez thought would be his last.
Everyone thought I was dead. That's what still haunts me every day.
The veteran journalist was on assignment covering the discovery of dismembered bodies in a parking lot near Rio Bravo in Tamaulipas state when he was suddenly confronted.
109 me interceptaron. At least 4 vehicles with armed people intercepted me. They kidnapped me, took me to a cliff, put a gun to my head, and literally pulled the trigger.
The gun didn't fire, and Humberto Gonzalez was eventually released. But the memory of the day he was levantado, a Mexican term for being kidnapped and beaten by members of organized crime, is seared in his memory.
I believe that Iraq, Afghanistan, or war zones are as dangerous as covering public security issues here. I imagine that is true not only in Tamaulipas, but also in Coahuila and Nuevo León.
Humberto Gonzalez reported his case to a federal entity charged with protecting journalists and human rights activists called the Mechanism to Protect Human Rights Defenders and Journalists. Created in 2012, the entity offers safe houses and panic buttons to help protect social activists and journalists in a country where drug-related crime is rampant.
We have more than 90% impunity, which evidently increases the desire of the perpetrators to continue committing offenses, to continue committing crimes, and to continue committing human rights violations.
On paper, the practical safety measures would seem to offer a solution. Some 495 journalists are enrolled in the system, but critics say the body is ineffective.
Es evidente que no funcionan.
It is evident that they are not well designed. It is evident that they lack criteria. It is evident that they lack resources.
From 2009 to 2021, we have documented 141 cases of journalists killed in probable connection with their journalistic work.
Overall, Mexico is ranked as the 6th worst country in the world to successfully prosecuting journalist murderers, says the Committee to Protect Journalists. But even with a protection mechanism in place, many working in the media don't feel safe.
I believe that not even companies can provide that type of protection, much less governments. Neither governments nor companies.
For Humberto Gonzalez, who still receives threats and says he is being watched, the protections offered by the mechanism does not bring peace of mind.
If they want to kill you, they'll kill you. I don't see that there's justice in Mexico.
Victor Castillo for VOA News, Reynosa, Mexico.
That's all for now. And just so you know, this was my pre-pandemic desk in the VOA newsroom. I miss it. Here's hoping that we all will soon be able to return to our normal lives. Meantime, follow me on Twitter at CarolynVOA for the latest on the pandemic and other news. Connect with us on Instagram and Facebook at VOA News. And stay up to date online at voanews.com. For all of those behind the scenes who brought you today's show, thanks for joining us. I'm Carolyn Pursuti, and I'll see you again next week for The Inside Story.